Adjusting to life after fighting in a war is a battle only veterans can really understand.
With more than 400,000 veterans living in Indiana, one veteran spoke to WRTV's Nikki DeMentri about the organization he created so vets don't feel alone.
Matt Hall's calling in life is to help others.
It gives me the passion. That's what gets my fire going. That's why I stay in.
It's the driving force behind his military service. The Fisher's dad is an Army combat veteran who served 3 tours of duty, twice in Afghanistan. Today, and for nearly 30 years, he remains in the Army Reserve.
At the end of 2010. Training with the Mongolian soldiers.
Hall's seen firsthand the issue of veteran suicide. At least 5 fellow soldiers he knew died by suicide.
One death by suicide affects 135 people. That ripple goes far and wide.
Helping just one person is the reason he heads the Indy Warrior Partnership.
Just like you, just like me, we're all one significant life event away from being in crisis, from needing assistance.
The idea is to build a community for Central Indiana veterans. Through the IWP, veterans are connected to local resources like employment, housing, and benefits. There's also 24/7 support via phone.
We want to create the community, and we want to have people know, and we want to have them connected to the resources so that suicide, it becomes less of an option.
For 20 years, psychiatrist Dr. Alexander Nicolesco worked with the veteran population, including here at Richard Rodebush VA Medical Center. He's seen nearly 5,000 unique veterans, both here in Indiana and elsewhere.
This is sort of an emergency. We're not dealing here with chronic health issues that can be managed over the years. Lives are lost daily.
Nationwide, the U.S. Department of Veteran Affairs reports 2020 saw the lowest number of veteran suicides since 2006. Still, it's the second leading cause of death for veterans under 45, and Indiana's veteran suicide rate is, quote, significantly higher than the national veteran suicide rate.
The key is prevention, is catching early on the risk factors before they sort of spiral out of control. If you see something, say something. You might save a life.
Working for you, Nikki DeMentri, WRTV.
Well, advocates like Hall share concerns over the VA's recent report illustrating a drop in veteran suicide numbers nationwide.
They worry the data shows an undercount in numbers. Both the VA and Hall say work still needs to be done. And Mark, I talked to a veteran that Hall actually helped. I'm going to bring you that story tomorrow here on the news at 6 o'clock. But that veteran says he's made a huge difference in his life.
Great to hear that perspective, too.
Definitely.
Any veteran in crisis can get help 24/7. Dial 988 and then press the number 1. That's the Veterans Crisis Line. You don't have to be enrolled in VA benefits or health care to get help through this number.
Another resource for veterans is HVAF of Indiana. The organization's main mission is to end homelessness among veterans, but they provide other services, too.
Employment is another big piece. So we have a robust workforce development team that is providing a lot of hands-on employment assistance to help our veterans gain and maintain stable employment. And then we also have a food and clothing pantry. So every Tuesday and Thursday, that's open to any veteran in our community. They can come in, get food, get clothing, get hygiene. They can sign up for additional services if they so choose.
Again, HVAF's pantry is open Tuesdays and Thursdays from 11:30 a.m. to 2:30 in the afternoon. That is located at 964 North Pennsylvania Street here in Indianapolis.